Hey everyone, Happy New Year. It is our very first chamber check-in of the year. And today we have owner and founder of Idaho Mobile Physical Therapy, Jason Labarth. Hi, Jason.
Hi.
Hey, thanks for taking some time with me. Thanks for your membership. You're a relatively new member, just less than a year. And this this is a great opportunity. These chamber check-ins are an opportunity for people to know what you got going on, learn about what your programs and services are. But I love the part where we get to talk about the history and your why you're in business. So with that, can you tell us a little bit about Idaho Mobile Physical Therapy and how you got your start?
Okay. Well, I got my start. I started the business in November 2019. At that time, I could see that there were many ways that I could serve my patients better and make my work more enjoyable at the same time. So I tend to freeze up. I got a few notes here. So after about 20 years in the field and some frustrations with the system, I talked it over with my wife as any smart man would do, and she helped encourage me to take that step that I've always wanted to take but never really quite had the courage to do. And I reached out to a colleague of mine who's now practicing in Texas, and she's always been a very successful business owner. And she began to tell me about her new mobile physical therapy model. And the ironic thing is that I remember then that my wife, Angie, had actually brought that idea to me several months before. And I thought she was crazy because no one else was doing it. But, I quickly began to see the appeal of the appeal and understand, the genius of that system. And now I am able to treat my patients much better, and my work is much more enjoyable, and I even get to spend a little more time with my family.
That's awesome. When I first met you and you pulled up in your mobile vehicle, I thought, hey, this is great. The timing of having a business that's mobile is huge right now, because those folks that have had surgeries, that are trying to recover and get some good physical therapy, still may not be comfortable in going in places yet. So the fact that you go to them is huge.
Right. Yes, a lot of my patients are really enjoying not having to go into a crowded clinic, which increases your risk of exposure to the virus. And I take all the precautions I possibly can. I clean off my table before and after each patient. I clean off my equipment before and after each patient, and I do my hand sanitizer before and after each patient. I take every step I can to protect me, protect the patient, and help prevent the spread.
Okay. Well, that's a great segue into let's go into a little bit more detail about your services.
Yes. Thank you for asking. I had a few things I was hoping to touch on. So as a mobile therapist, I come to you at your home or your office or wherever you would like to meet. I can offer odd appointment times in the evenings and on the weekends. I'm the only mobile orthopedic therapist in the Treasure Valley, at least that I know of. I've been specializing in orthopedics and sports rehab for about 20 years now. And right now, one of my main focuses is helping busy professionals, maximize their physical health and performance while fully accommodating their complex schedules. And I'm able to, devote the kind of time and undivided attention that a lot of therapists, just can't do in a normal clinical setting. I want my patients to feel that with me, they get a result and not just therapy. For example, I want to help my golfer finish 18 holes without having to stop because of low back pain. And that requires a lot more than just treating a low back with, a massage and some core exercises. And I want to help my runner finish the marathon without having to stop because of throbbing knee pain. And I want to help my pitcher finish the game without having to stop because of debilitating shoulder pain. And I offer a golf fitness program, which is gaining a lot of popularity here in the off season. I also offer an injury prevention program, and this is very helpful, for example, in ski season when a lot of ACL injuries happen. So I offer a lot of good services, and I thank you for helping me get my word out.
Absolutely. So you talked about golf, and in our office, you wrote a book, Strength, Stability, and the Golfing Athlete.
Yes.
This is pretty cool. Why don't you,
I also wrote that one too.
Why don't you let's talk about that for a minute, because we're in Boise right now. I've seen people golfing on Christmas Day here.
Right.
And as we head into spring, what are some of the tips and tricks you have for those that are getting ready and have kind of had that long winter's nap and are coming out of hibernation and want to get out on the course?
Okay. Yes. Kind of the basic premise of my program, there's been a lot of research done on golf swing efficiency. They've done studies and shown, where you need to be more flexible and, what muscles are more active and need to be stronger. A lot of the professional PGA Tour players, they undergo, a comprehensive 2-day assessment. And this is a group effort by a number of different professionals, including the sports physician and the golf swing coach and the physical therapist, the fitness trainer. And what I do is, the first day that I meet with somebody, I spend 90 minutes doing that physical assessment that the tour therapist does. So we try to identify any physical deficits that could be inhibiting your golf swing and talk about how that may manifest when you do hit the ball. Then we develop a program to address some of those specific issues, so you can have a more efficient and a more accurate golf swing.
That's the key, right? Hit it straight, far, without getting hurt.
Yes, that's exactly it.
Awesome. So on the bottom of the screen, we have scrolling your website and your phone number. If somebody were to call you, what's your turnaround time? Are you available tomorrow? And like, what's that look like?
Yeah, I can get you I can come see you the next day. Okay.
Yep. And as far as insurance and stuff, you pretty much accept everybody's stuff?
I am not contracted with any insurance companies right now. What I do is I provide a super bill so that people I work with can submit to their insurance companies and get reimbursed after the fact. And that's actually turning out to go much better than I originally anticipated. But that's how that works right now. Might be changing. I'm thinking about taking 1 or 2 plans in the next upcoming weeks here, but that's how I do it right now.
Okay, cool. Hey, I also would be remiss to not mention, how have you held up through all this pandemic, and how have you shifted your sales?
How I've held up through the pandemic and how I've shifted my...
Yeah. How did that affect your business, or did it affect it positively?
It's kind of had its pluses and its minuses. Like I said, the people that I work with, they really enjoy not having to go to the clinic and having me come to them and mitigate that risk. On the other side of that same token, it's making it harder for me to touch bases with and meet people and get my word out. So it's got its ups and its downs. Yeah.
Absolutely. Well, that's the hard thing about COVID is what we've had to do to, remain relevant and on top of people's minds. So that's another reason that the chamber's doing these check-ins, is to, create an additional little bit of exposure for our members. So, I love what you guys are doing. Thanks for your membership and investment. in this organization and the community in a whole. What you guys do and what you offer. Thanks for giving your energy to health, people's health. Thanks for getting them ready for golf coming up. And I encourage anybody. Yeah, go ahead, Jason.
There's one other program that's turning out to be very valuable right now is my injury prevention program. I think I kind of touched on that earlier, but as an example, this is the time of year when everybody's a lot of people are skiing, and this is when a lot of ACL tears and ACL surgeries happen, and that can lay you up for 9 months to a year. But a good therapist can do an evaluation and determine if you are at increased risk for tearing your ACL, and then again we can implement a program to mitigate those risk factors and prevent an ACL tear before it happens. Statistically speaking, teenage female athletes like soccer players demonstrate a higher rate or incidence of ACL tears during their sport. So that's another group that could benefit greatly from a program like this. There's that.
Okay. Hey, while I'm talking to you virtually, do you offer any telehealth? Like, can people call you and do a conversation like this and be like, hey, my arm's hurting? Tell us a little bit about that.
Yes, I absolutely do offer telehealth.
Okay, so just call and then they can schedule,
Yes.
and you guys can have a conversation and be like, what ails you?
Yes, exactly.
Okay.
I do a free 20-minute phone consultation with anybody who's interested right off the bat. But then you just reach out to me, and then we can coordinate the telehealth, and we can do it that way if you like.
Okay, great. All right, make sure I covered everything. We talked about the story and the history of your business. We talked about your different services. You do massage as well?
Yes.
Okay, so massage, any type of physical therapy. If you've had surgery and your doctor prescribes a physical therapy, you can reach out to Jason. That's a lot of stuff, and he'll come to you wherever, at your place of business or your home or somewhere where you guys both feel comfortable. At the Boise Hawk Stadium, there's plenty of room there.
I am a very hands-on manual therapist. I also am certified in dry needling and certified in cup therapy, and I'm certified in A-stim, which is a form of myofascial scraping for anybody who actually knows what that means. So I got a few tricks in the bag.
Can you help me with my wrinkles, Jason?
I don't know what to do about that. That's a different specialist.
Hey, again, congratulations on your business. Thanks
Thank
for
you.
your membership with us. Thanks for your investment in the community, Jason. Is there anything else you want to tell the group while we got you on the horn here?
No, I think I've bent your ear enough. Thank you so much for having me. I appreciate it.
You're welcome, Jason. Have a great weekend, and maybe I'll see you up on the slopes or at another chamber event coming up soon.
See you soon.
Bye. Say hi to the fam for me.
I will do.